After consuming a carbohydrate-rich meal, digestion begins breaking complex carbohydrates into simpler molecules within the gastrointestinal tract. These carbohydrates are converted into glucose, which becomes the primary energy source for most cells in the body. The fructose go to portal vein system.
Absorbed glucose enters the bloodstream and travels directly to the liver through the hepatic portal circulation. But fructose travel directly to liver by portal veins. The liver acts as the central metabolic organ, carefully regulating blood glucose levels after every meal, and metabolize fructose also. In response to rising glucose levels, the pancreas secretes insulin into the bloodstream. Insulin secreted is exactly proportional to level of glucose. Insulin binds two specific receptors on hepatocytes, triggering intracellular signaling pathways, CCL, for receptors are stimulated by insulin and get into the cell. This signaling promotes glycogen synthesis, allowing excess glucose to be stored safely within the liver. In type 2 diabetes, liver cells develop resistance to insulin, means insulin is there, but cells are not responding.
Because cell is already saturated with glucose, now cell is not responding to insulin, it is called insulin resistance. Although insulin is still present in the bloodstream, the intracellular signaling pathway inside the liver cell becomes impaired and significantly less effective. As a result, glycogen synthesis within the liver decreases significantly, and the liver loses its ability to efficiently store excess glucose after meals. Glucose continues to accumulate in the bloodstream, leading to persistent hyperglycemia and placing increasing metabolic stress on the entire body. Despite already elevated blood glucose levels, the liver continues to produce additional glucose through the process of gluconeogenesis, further contributing to rising blood sugar. In this process, amino acids are converted into additional glucose molecules. This newly formed glucose is then released into the bloodstream, where it further increases overall blood sugar levels and worsens hyperglycemia. This further elevates blood sugar levels, progressively worsening the metabolic imbalance and placing additional stress on the body's regulatory systems. The liver also breaks down stored glycogen in a process called glycogenolysis. It further worsens glucose level. This breakdown adds even more glucose to the bloodstream, further elevating blood sugar levels and intensifying the hyperglycemic state. Together, reduced storage and increased production sustain high blood glucose levels. Persistently elevated glucose levels gradually begin affecting multiple organ systems, disrupting their normal structure and physiological function over time. Over time, persistently elevated blood glucose levels begin to damage blood vessels, increasing the risk of serious long-term complications. A healthy liver responds efficiently to insulin, allowing it to store excess glucose and maintain stable blood sugar levels. In type 2 diabetes, insulin resistance disrupts this vital regulatory mechanism, preventing the liver from responding properly to insulin signals. The result is decreased glycogen storage, increased hepatic glucose production, and persistently elevated blood sugar levels that define chronic hyperglycemia. Liver play very important role in control of glucose level when its functions got disturbed by explained before in this video by process of glycogenesis and glycogenolysis. Liver function is directly proportional to insulin resistance. The end result is fatty liver and complications. The easiest way to escape these changes in liver and complication is very conscious sugar level control, otherwise liver get worse and worse leading to liver cirrhosis.